Thank you. I'm Dr. Rod Wallace. I'm the president of the Foundation for Innovation in Healthy Food, which is organizing and coordinating the Coalition for Grain Fiber. And as we begin, I'd just like to say, it was Thursday that I was talking to Sean Finnie, who's a co-author of this presentation. And he was talking about how energized he was to participate and be at the Seeds of Success conference here with you and discussing how we're responding to the emerging health and agricultural challenges and opportunities. And he said, just with the uncertainty at USDA, I can't plan 5 days in advance. And then, of course, that afternoon is when I got the email that he was not going to be attending, that his job had been eliminated. And that's horrible because he's spent a lot of time earning an incredible reputation as an individual and as a scientist. Even though he couldn't plan, though, I expect that he was incredibly well prepared. His resume was up to snuff. He probably had a list of a lot of people to call, a lot of them in this room, about where to go next. And of course, he'd invested a lot in that reputation that he'd certainly earned. And the last sentence in the email that I got from him, I think, was telling. I'll reach out when I've landed at the next place. Because even though he couldn't plan, it was certainly unforeseen, it was something that he could prepare for. And I think that concept of planning versus preparation is one that's really important when we're thinking about the Coalition for Grain Fiber, because I don't think anyone in this room is able to forecast predictably right now what is going to happen in the next 1, 2, 3, 5 years. But by preparing really effectively, we are able to leverage the shift and the changes that everybody of any political stripe expects to be happening. We're talking about a new paradigm. My interest is in the public health, but for this presentation, we understand very critically that to make something like this sustainable, wheat for health, we must take the perspective of the wheat value chain. How to make things profitable for the people that are participating who are going to make something healthier. So what we'll talk about is why wheat fiber for value and position, where the value is and how we can start tomorrow. Then we'll come back and talk about the Coalition for Grain Fiber, which has been preparing to make a shift to look at nutrition and diet as a quality dimension of wheat for the last 3.5 years. Wheat as a strategic position. Why look at public health? Well, it begins by the fact that everybody in this room knows that at a price of somewhere around $5.50 a bushel, it's really challenging. Last year, U.S. farm profit was the lowest since 2006, about 20 years. And everyone knows in this room that wheat is the least profitable of the major crops. And then if you look forward, you have, on the one hand, ongoing international pressures. The increasing supply from Brazil is expected to continue. More corn, more soy, more corn, more soy, potentially more wheat. At the same time, wheat specifically, you've got expected increasing pressure from the Black Sea in Australia. Any one given year, you can get lucky with weather, but from a strategic perspective on an ongoing basis, that's not too good. And then Josh Sosland from the Sosland Publishing, in a recent editorial, highlights everyone in the wheat supply chain should recognize that for various reasons, wheat is in the sights from multiple perspectives of the new administration. Everyone recognizes and remembers what happened in terms of tariffs the last time we went into tariff competition in 2016, 2017. Farms were some of the most deeply impacted, and the government had to find a way to get more profit to the farms to react to that. Highly processed foods, the pressure on that from a perspective on health, no matter how questionable the definition of highly processed foods is, it's likely to continue. Food aid, which was recently eliminated as probably the third or fourth largest destination, export destination of wheat. On the opposite side of the value chain, SNAP, which is a destination for a lot of baked goods, is certainly going to be under pressure. And from a strategic perspective, when you think about the competitive positioning of wheat in this type of environment, where all of the businesses involved still need to get the kind of profit and the kind of returns that their investors, whether they're a family or they are a business stockholder, you need to get the returns. And in that type of environment, you need more value. That is the only route forward, which is why we're looking at nutrition and diet and health. Because from a public health value perspective, the increase in fiber that we're targeting has a value of about $77 per bushel. It would be really nice, but it's not the case that if you just grow increased fiber wheat, you get $82.50 a bushel. That's not what we're saying. That $77 is the amount the farmer profit, the value chain benefits, the healthier communities, government savings, yes, net government savings, gets from this. And when you're talking about that much value, you say, in this situation, you've got to take a serious look. This value is coming from the immense cost of the chronic diseases. The US healthcare cost of cardiovascular disease and diabetes, that's like the needles, the doctors, the nurses, those costs, it's about $700 billion a year, which is just a big number until I realize that's 50 times the value of the entire US wheat crop. And that doesn't take into account that these diseases kill people. It doesn't fully take into account the fact that millions of people have the quality of life decimated by the fact that they get these diseases. But again, let's just focus on that $700 billion number for a second. You take that and you get it for the average American family, say 5 people, is more than $10,000 a year. Which means that every 2% reduction is like a $200 gift card from the baking industry to every family across America. That's a lot of money. And going, on one of the slides, we'll talk about just intuitively, what fiber does is it strengthens the systems that keep our bodies healthy. And so there's a very good chance that this doesn't include the value of reducing the risk of other diseases that is likely to occur when we increase the level of dietary fiber intake. One of the surprises for some people may be that this value, the $77, is primarily in the wheat, not the fiber. Let me explain what that means. This is a pretty good sandwich, I think. I'd like it. Suppose we wanted something kind of similar to that sandwich, but with more dietary fiber. Who has some ideas of how you could increase the fiber in it? This isn't a trick question, it's a pretty simple one. Whole grain, yep, whole wheat bread. Anyone else? Who else? Another option. Guam, do you have any ideas? How about high amylose wheat? Right? Make the bread out of high amylose, wheat flour. Or there's avocado there. You could add another slice of avocado. There's dozens of ways that you could increase the dietary fiber in that sandwich. Add some peanut butter to it. So there's lots of ways to get more fiber, but is there anyone in this room that thinks that everyone in their extended family gets the recommended daily amount of dietary fiber? I don't think many people are going to raise their hands, because if they did, it would mean that everyone in their family is in the top 3 to 5% of Americans in terms of fiber intake. Nobody gets enough fiber. So if there's lots of ways to get fiber, but we're not getting it, the challenge is not finding new sources of fiber. The challenge is getting those fiber into our bellies. And that's where the power of wheat is, because people eat wheat. It's like 20% of global calories and protein. 17% of mass of food in the US that's consumed. I mean, the people that did fortification already figured that out. Because of the folic acid and the other things that are put on the white flour, that reduces birth defects 25 to 50%. Wheat is already the source of about a third of the dietary fiber intake, more than any other source. And yes, the bulk of that is coming from white flour. So what we're doing is talking about optimizing something that's already there, using methodologies and processes that were all developed in the past. It is, at its core, about saying new and improved. So avocados, high amylose wheat, whole grain, those are all wonderful ingredients. We should probably eat more of all of those. You can think about the arabinose island that we're talking about as an ingredient. There's all the strategies that you can do with that as well. But what we're really at its core talking about is thinking about new and improved. What's new and improved in terms of wheat? And that leads to a completely additional set of commercial strategies, marketing approaches, supply chain designs that may work or that can work in this context that we're talking about. We'll talk more about that in a second. But in the short term, let's just talk about, given the technology that we have today, what kind of fiber best fits this concept of enhancing commodity wheat, new and improved. Given the science that we have today, the first stage is arabinose island, which, Rachel Shandell is probably going to be late. She'll talk about the real science of it, but really, really simply, it's talking about increasing the level of arabinose island fiber in the cell walls of the endosperm, which means it's in the white flour and it's in the whole grain. And so because it's part of the grain, of course, it's clean label. The dietitians will tell you if you're going to get nutrients, the best way to do it is get them in this, in the actual food, because then the relationships with all the other molecules around it are the same as in the real food, and that's the thumbs up best way to do that. There's no yield loss associated with it, royalty free for all, minimal baking disruption. Talk about that. It's suited for broad application. You don't have the massive fiber increase that you have from the high amylose, but what you have is a more mild type of increase that allows it to be implemented at much broader scale. Once you get it into your stomach, what happens? And is this like crazy science, or is it? It's kind of there. This chart is really complicated, and so we won't go through all of it by any means. It was links the dietary fiber with type 2 diabetes and what's the relationship there. And the dietitians on our team who designed this said, you should kind of think of this as an undergraduate textbook type of chart. And by that, they mean that every single one of these arrows is established science. So for example, fiber-rich diet has an impact on your gut microbiome. Any expert in the gut microbiome will kind of nod and go, yeah, that's established science. Yeah, no kidding. And if you look at all the relationships in this chart, if you go to a health professional and they're looking at whether or not you have type 2 diabetes, they look at 5 factors. They look at your cholesterol level, your blood pressure, the level of inflammation, the adiposity, basically your whether you're overweight, and blood sugar and insulin. And dietary fiber has a well-established relationship with all 5 of those things. It makes each of those things better. And there is an equivalent relationship between dietary fiber and cardiovascular disease, dietary fiber and gut cancer. Yes, you still have to do the detail of exactly the specific molecules in arabinose island to the specific molecules in the gut microbiome and map at that additional level. That's good science that still needs to be done. But this is the reason when you talk to anyone in the health and they go, yeah, you're increasing fiber, I can nod my head in agreement and say, yes, that's good. One of the questions that we frequently get is our approach clinically significant? Which is a healthcare term that was designed for the types of things that healthcare does. Like, should the doctor do open heart surgery on you? And the concept of clinically significant is if you take into account the risk of the treatment. Like, you don't want a doctor like opening you up and doing open heart surgery unless you're going to make a massive difference in your health. Now, so clinically significant begins with risk. And in this case, there's no risk. You're talking about eating wheat. The rest of clinically significant is just a basic economic question. Is there positives that result from what you're doing? And for those of you who are associated with business, I'll say, well, we've done the calculation now and integrated all the information. It's $250 billion in net present value of public health benefits. Is that clinically significant? Yeah. It's the biggest, most positive food-related project I've ever seen. Millions of people expected to be spared from chronic disease. Millions. We project billions of dollars in healthcare costs saved annually with reduced risks of chronic diseases. What are the reduced risks? 1% to 3% less heart disease at a population level. Of course, only the 98% of Americans who actually eat wheat-based foods are going to benefit from this. So there's 2% that won't get it. Everybody who eats wheat-based foods benefits. It's 3 to 4.5% less type 2 diabetes, and that's huge. 1.75% less gut cancers. And it's pretty attractive from an investment perspective. Roughly $120 in public health benefits per $1 in cost in the US. And so, yeah, American healthcare costs are just crazy high. But at that kind of ratio, yes, we've had just exploratory conversations with people in Kenya and India. And they go, oh, this is interesting. We can make our wheat a little bit more attractive. And that may be an attractive way for us to save our healthcare costs. And the Philippines and Japan and everywhere else. Another question that we get is now the time to keep people healthy? There's so much change going on right now. Shouldn't we wait until things stabilize and there's no more change and then we should change? Well, I can understand from a historical perspective some of that perspective. You know, this chart has U.S. share of GDP. That's basically the percentage of the economy that's dedicated to food and healthcare. In 1960s, Americans spent twice as much on food, that's the red line, as we did on healthcare. And then the food industry, relative to other industries in the U.S., was really good at cutting cost and keeping the cost constrained. As an industry, and I was part of the industry, we were much less successful at getting reasons for people to spend more for their food, whether it's for health or indulgence or convenience or anything else. It was just a tough slog to get people to pay more. And so it shrank. On the opposite side, U.S. healthcare, they're the masters of chronic disease right now. If you get a chronic disease, then you go to healthcare for the rest of your life. They've been exceedingly effective at getting people to spend more on on what they have to offer. I don't think it would surprise anyone to know that Americans spend twice as much on healthcare as we do on our food today. Maybe a little bit surprising that this little yellow dot, which is that American government spends more on healthcare than consumers spend on their food. And then coming back to the question of, is now the right time? Well, a lot of people have heard about Make America Healthy Again, Robert Kennedy. And a quote from him when he was talking to Congress, "We will make our tax dollars support healthy foods." Boom. Lisa Murkowski, the Republican from Alaska, and about why was she supporting Kennedy, said, instead of focusing on who covers our exorbitant healthcare costs, we need to reduce these costs by directing our attention to prevention and keeping people healthy. Thus, that resonates with her constituents in Alaska. Just from informal conversation, it resonates with people in Delaware. I expect it would resonate with people in Kansas and Texas and California and Massachusetts. This is what we need, and I think a lot of people recognize it. So how can we start tomorrow? And tomorrow is metaphorical. We're not talking about Wednesday. I mean, you got the Wheat Quality Council that you have to enjoy before we actually go ahead and start. But I think that we may have underestimated the power of this insight from Peter Shuri and the team in the UK when we first began this project. This chart happens to be focused primarily on European commercial wheat varieties. And this is the level of Aragonese Island fiber in different varieties. And it shows that some of them have very low levels of fiber, some have mid levels of fiber, and some have really high levels of fiber. And we spent a lot of time focusing on the fact that the absolute number one here happens to be a Chinese wheat variety rather than a European one, but the vast majority of these are European commercial wheat varieties. And you know that if they're commercial wheat varieties, they're high yielding. They work well in a bakery. And so the ones over here got that yield and bakery thing down, and they happen to be, relative to their peers, healthier for us. Increased fiber wheat is already here. It exists by chance. And we'll hear some of the data that was developed by the team in the Western Wheat Quality Lab coming up pretty shortly, saying that, yeah, in the US, we have the same pattern. So what does that suggest? Multiple generations of better wheat. First generation, existing high-quality germplasm. Holy cow, this particular variety that I already knew was going to work well on a farm and in a bakery is really healthy for us? Cool. Second generation, identity royalty-free QTLs. You use the science and get an even higher level of fiber. Third generation, and so on and so on. That's the basic concept. Dr. Shandell, her plane was late, so we'll go ahead and leave these for later, which talks a little bit about the Aragonese Islands. And I will hand off to Katherine.
All right, so I was just going to give an update on some of the current status of CGF efforts. I am one of the science leads for the team, focusing on plant breeding. I work with Atria Iba from CIMMIT on the end-use quality side, as well as Kim Campbell on the plant breeding side, and then Devin Rose on the public health and nutrition aspects. Currently, where we're at right now is we are, as you're going to hear in the next presentation, working on evaluating current hard red winter, hard white winter, hard red spring, as well as the soft wheat market classes. Priority for moving most quickly will be in those hard wheat classes. We know that that's likely to be where it is most easily deployed. We know that we have variation. We also know that we have variation for water extractable and water unextractable Aragonese Islands. So that means there's a lot of really cool opportunities for addressing different types of functionality, different types of products, different optimization schemes. So like Rod said, that's what we're planning on as our first generation set of varieties. We are also currently working on integrating some of those QTLs that we've discussed previously. Many of us have crossed with some of the donor varieties. We have several breeders who are working on developing doubled haploids with both of those QTLs. So optimistically, we expect to be able to deploy varieties with those additional QTLs relatively fast. Our end-use quality teams are doing a lot of work right now to develop documentation that our end-use stakeholders need to start thinking about how they could potentially use this high fiber wheat in their products. So we have worked with several different companies or groups to identify what information they are most interested in or they need now in order to start planning for a transition towards more high fiber varieties. Um, so that, and then again, that is advancing most quickly in the hard wheat sections. Um, we do think there are opportunities in the soft wheat products, and this is really a potential for more of those novel products. What are some things that we don't have on the marketplace right now that could be developed to be healthier, higher fiber consumables? And then I think really exciting is a lot of that public health research. It's going to benefit both the plant breeding side and the end use quality side because we get those questions. Well, how much is this going to help? What are the possible clinical outcomes? So we have several studies underway in small scale, either in vitro or some mouse studies ongoing to really document what the potential health outcomes of consuming more arabinoxylan-based fiber is. So we're really excited. We're about halfway through the mouse study. That seems to be what I remember talking to Dr. Devin Rose at University of Nebraska last. So hopefully sometime towards this summer, we will be able to share some of the results from that mouse study. Really excited about the fact that, this is something that people are going to consume multiple times throughout the day without major side effects. And it really has the potential to be something that our endocrinologist, our cardiac specialists can say, look, I know you don't want to eat whole wheat products, but try these increased fiber wheat products. They taste just like your white wheat products, your white flour products. So that's really exciting. We have been talking with faculty or researchers at the University of Nebraska Medical Center, and they all agreed that this is a really cool opportunity for them to actually see dietary change in their patients. They all say, yep, we tell our patients they need to do these things, and very few of them see the amount of follow through that they need. We've talked about this a lot. This is just a reminder that we have QTLs from UMI 34 that's associated with total AX, so water extractable plus water unextractable arabinoxylans contents. That 6B QTL is primarily associated with water extractable arabinoxylans. These are what we're working to deploy in our market classes. These have been documented through primarily that UK research, and we're looking to add this to existing US variation. Looking at those end-use quality characteristics, I just mentioned the water extractable and water unextractable. Water extractable arabinoxylans are going to be that easier class to work with, especially in the hard wheat products and our bread products. We see that actually, okay, yes. I was misreading the slide for a moment there. Yes. We see a lot of positives in those characteristics we need for good quality bread products. That's less of a positive for most of our cookies and crackers, those lower moisture content products, but potentially a positive for those doughy applications. One thing that we do note here when we're talking about water unextractable arabinoxylans, there are side effects on here, potentially that decrease in bread volume, because we're interfering more with that gluten network formation. We can work with our xylanases to deal with some of that, but also it's important to remember that that water unextractable fiber, that non-digestible fiber, could actually have more beneficial effects on our microbiome than those water unextractable or water extractable arabinoxylans. This is really hard to say those two words repeatedly on one slide. So even though there may be some negative aspects of the unextractable arabinoxylans, we can potentially deal with them, but also there could be really some beneficial health effects in those water unextractable arabinoxylans. And let's see, I'm handing it back to you for this.
So we do have about 15 people on who are virtual. If you are virtual, hello. And if you where you have questions, if you just put it into the chat, that would be great when we have the sessions. The Coalition for Grain Fiber, it's coordinated low-cost transformation to basically add an additional dimension of quality that can be developed. We have the scientists. We have a coalition to increase intake of dietary fiber because you got to make sure that the science leads to some real actions on the ground. And there's the foundation, which is a very small organization at the top, Foundation for Innovation in Healthy Food, coordinating, connecting, helping ensure that there's the customized sets of methodologies for things like intellectual property management, for things like statistical analysis of low dose increases in nutrients. That type of thing is available. And it's relatively straightforward. The science has attracted a seasoned commercial and science team. It really is a world-class team. There are people participating from farmers to members of the supply chain, sales, marketing, public relations. I think that those numbers are represented relative to what we actually have. There are 38 plant breeders and geneticists participating, 15 from the cereal chemistry and food science side to make sure that the baking works well, 8 on the nutrition and health side to make sure that once it enters our bellies that it does what we expect it to, and 6 from the socioeconomic side, which is about money because that's at the end of the day what is important for these participants. Ed Souza is not alone on the world-class science advisory team. I'm not sure how he got such credit. It's really wonderful that he does. He is one of the members of the science advisory team, but there are 11 really, really high-class representatives on the science advisory team from academia, from industry, from government who have participated and are participating in each of those components of what's going on. So what's the basic concept for bringing the high fiber wheat to market? And really, there are 3 components to this. One is food company led. You all know that Grupo Bimbo has announced that they're increasing the level of dietary fiber in all their foods by 2030. Nissin Foods says, with a more traditional ingredient strategy, hey, we want some increased arabinoxylin in wheat. We're not sure. It may just be for like animal feed. Okay, nothing wrong with that. Cool. Second, is policy supported? Well, are you serious about policy right now? Maybe, maybe not. In 2029, you got the Farm Bill coming up. That's the more traditional policies. And everyone knows in 2017, when we had these major tariffs, it just decimated farm exports. And the government made the choice to give farmers a lot of money. I can't imagine a more attractive way to provide farmers money than to say, look, do this, choose increased fiber varieties, save us in government money, and make everybody else healthy. Is that going to work? I don't know. Certainly attractive pitch, though. And then we have mentioned, just first conversations, Kenya, India. Does this work for you guys? Would you guys be interested? Yeah, dot the I's, cross the T's, and we think this is really cool. Third, resilience-driven for farm ecology and health. Resilience-driven initiatives exist for a reason, to enhance the sustainability of farms and farming profitability. at the same time to enhance ecological, environmental benefits? Well, the people here know that wheat is a really effective cover crop in a lot of situations. Incorporate wheat in this, and yes, it does require some reconfiguration of some of the targets, but yeah, incorporate wheat in that, and it's high fiber wheat, and you all have something that's really good for farmers, it's good for ecology, and it's good for human health. Right now, certainly with funding from the government likely to be significantly reduced, and some of the people focused on this, looking for how do you make enough scale to make an impact with that. If you can get farmers, ecology, and human health involved, that can be an attractive pitch for them and going, okay, this is how we can get money for this and how we can have a positive benefit in a realistic scale. We have spent the last 3 years talking about what is a robust toolbox of foundational knowledge. The Foundation for Innovation in Healthy Foods is not going to sell a bushel of wheat. We have no, well, we might sell a bushel of wheat for science purposes. Okay, I take that back. But we're not going to sell any commercial scale of wheat or flour or bread. But you still need to know, how do you do all this stuff? And an example, okay, it looks like fluoroglucanol measurement is the most attractive methodology, at least currently, for measuring arabidopsis island fiber. What is the implications in terms of the contracting methodology with the farmers? How does that implicate how you design a supply chain that will actually work with this? It's actually, it all makes sense and it all works together pretty nicely. Second, winter versus spring wheat. Okay, spring wheat is more expensive than winter wheat. Does that mean that increased fiber in spring wheat is more expensive than winter wheat? No, actually it doesn't. They both look about equally attractive in terms of increasing the fiber level in terms of them, until you look into the details, and one may not, but both of them are potential. Everyone knows that the wheat value chain is highly competitive, margins like this. There's also some inefficiencies in it. And can we leverage those inefficiencies so that this comes into play, so that there's opportunities to create even more value through this by eliminating some of those inefficiencies and using this to create more value to be shared by the folks in the value chain? And last, mass balance quality improvement. We're going to talk a little bit more about that because there's a lot of different ways to execute on this. And just want to highlight one example of it, and we're going to get a lot more of them this afternoon during the panels, but I think can kind of just help people wrap their minds around what kind of things can be possible when you talk about new and improved for wheat. So there's execution opportunities from all the way easy to really challenging, and presumably you would only do the challenging ones where the revenue opportunity is aligned with that. But on the easy to execute side, you have mass balance quality improvements. This is a quote, both of these are quotes, proven methodology of gradually growing the share of certified materials in existing infrastructures. It's common, for example, in palm oil for sustainable palm oil to stop reducing the tropical rainforest deforestation. It allows commingling of convention and improved quality ingredients to keep the cost down. And this is, this quote came from folks in like the plastics industries, where like a plant is like $500 million. You're not going to grow like a mini plant just for, specialty stuff. It ain't happening. And so the basic concept is that a farmer gets some certified increased fiber seeds and grows them. They may also grow some other seeds, other wheat. And they sell it to an elevator who buys from that farmer and from other farmers. And then the elevator sells to a mill that also buys from other mills. And the mill sells to the baker who also buys from other mills. And then at the end of the day, the consumer gets something with a nice little thing on their package that says, better wheat, better lives. What you're doing is helping to fight chronic disease with every purchase. Because it's part of this supply chain and it's linking it. But it's really inexpensive to do. And it allows you to step by step move towards increasing scale, which is necessary for some of the higher cost opportunities. Again, just one example, but one I think that is an interesting one given the types of challenges that everyone knows there are in supply chains. In terms of coalition to increase intake, what are we talking about? Well, for farmers, we're talking about in-field days, and we will ask some of the people who are here today who have field days to just spend a couple minutes talking to farmers about the Coalition for Grain Fiber, what we're doing, what is the business opportunity for that. It's dollars and cents, right? That's the reason to look at that from a farmer. At the same time, they are given a handout, which on the front has the business opportunity. And on the back, it says, look, the source of this business opportunity is the health impact of dietary fiber. Here's some things that you could do with your family if you choose to enhance the health of your family. It's a business opportunity to also enhance health. Nutritionists, dietitians, and university extensionists, they are dedicated to enhancing the role of nutrition in health. What we're talking about is transforming food, enhancing the nutritional quality of food at scale in a way that can have a massive, real material impact on healthcare and population health. They love that. At the same time, dietary fiber is something that has not been really pulled out extensively on its own. They're interested in it. They're interested in the gut microbiome. They're interested in inflammation and some of these other things. So we all package that together with them and say, hey, come on and you get your continuing education, and it's a wonderful way for everyone to get what they're doing. They're attracted by the transformational piece. They get the stuff that they can use on the daily basis with their patients. Thumbs up, everybody wins. Underserved communities in Illinois and Nebraska with various other partner organizations to look at the role of grain fiber in helping those communities get healthier. Lower income community development, collaboration with Delaware State University, Southern University. Those are both historically black colleges and universities. And it's about helping people of various communities develop their own programs. You know, a social entrepreneurship student competition. Can the students in the university come up with healthy baked goods supply chain for their own communities? Cool, thumbs up. Sounds like fun. A case study. Some of these universities have a lot of trouble keeping the students in school. So give a case study of what this is so that they can understand how the relationship between the science that they're studying in school relates to making the communities that they care about healthier. And so they can go, oh, the science actually is worth learning. And of course, similarly, some creative, innovative approaches to community outreach that's unique to those communities so that those communities can use the way that they are structured to really multiply the messages that they've got in terms of grain fiber and the importance of that in human health. I will pass it back to...
All right. So following up with what we're talking about for community outreach, how are we doing some of that scientific outreach? What is our upcoming goals and strategies? Currently, we have a policy paper that was really ignited by last year's meeting, same time associated with the Wheat Quality Council meeting last year. So our discussions really advanced into this white paper, and now we have that under review. We have submitted a AAAS symposium. Don't know if that is accepted yet, but that was viewed as this is really neat, could be a great addition to our agenda. We continue to have those team meetings. One of the important things for almost every scientist right now is what are our funding opportunities? How have those changed in the past month? And how do we move forward? How do we continue our work so that we can get it into publications and we can snowball from there? We have a draft budget. We are constantly talking about how we can address this. A lot of it comes down to getting some of that preliminary information, especially some of those mouse studies done, so we can really truly demonstrate the value, and then start thinking about additional places where we can look for funding. Whoops. One of the really interesting connections we've recently made is with a group called the Periodic Table for Food. Um, this is a group that is really interested in optimizing diets by combining different food sources to get that nutrient balance. However, they do recognize that if we can optimize the food, those food inputs, then it's much easier to make those prescription type diets. So what we have as an example up here is a kind of a breakdown of nutritional values from Plum, and if we're deploying Plum as a way to optimize your diet. How easy is it to go get a good tasting plum in the middle of the winter in Kansas here? Not that easy. What can we get that's real tasty? Our wheat is still real tasty. So they really do see that this CGF effort could be a great way to really work with individual food ingredients to improve that optimization. They have seen, as they work with different food crops, seen that cultivar can have a huge impact. And especially when you're talking about fruits, for example, here, we all know that those are really visible differences for cultivars. So that is something that really has just occurred in the last couple weeks. We are connecting more with them. And if you're interested in learning more about the periodic table food, connect with Rod. Let's see. I'm trying to remember. I'm still going here. Okay. Thinking about the future, we've talked a lot about aminosylans. That really is our number one aspect right now, but it is not the only aspect that we can talk about for wheat. We've got beta glucans, lignans, cellulose, also combining these high fiber wheats with increased micronutrients, that iron and zinc. So really thinking about how we can move beyond just fiber. Um, you know, we know that flour consumption has decreased. How do we make it work harder? Can we reverse some of that flour consumption decrease if wheat is viewed as a healthy food again? All right. And so with that, just want to wrap up by adding that we do have a little bit of time for question and answers, I think, here. Otherwise, we can go into the next speaker. But are those online, please feel free to turn on your video to ask questions. We can have you ask them or live, or go ahead and put them in the chat.
Okay, yeah, we have a question from the virtual audience. It says, any grain yield reduction with increased arabinoxylon content?
No, not specifically due to the arabinoxylon content. When we're talking about introgressing different QTLs from different market classes or different sources, yes, we can see a temporary reduction, but we do not see yield reduction specifically due to that trait. So that's really great news. Oh, you got one right there.
Okay.
Yep.
My question would be, have you done research on fiber content and how it might affect the celiac problem?
All right, so that's a really good question. The fiber content, so what triggers that celiac inflammation would be the gluten, the protein components of the wheat. So when we're adjusting the fiber content, we are not doing anything that should explicitly change that reaction. Anytime you change components, there could be a risk, but we do not anticipate that it would increase or decrease the celiac type inflammation. We would really need a whole other area of research. There are people working on that. And potentially, down the road, maybe that is something that we can combine with this high fiber wheat.
You mentioned with some of the water unextractable fiber, the potential gut microbiome benefits and the ability maybe with some of the xylanase enzymes to reduce the negative baking impacts.
Right.
Do you have any indications whether the use of those xylanase enzymes would also reduce then the beneficial outcomes of the microbiome effects of that fiber?
That's a fantastic question. I wish I had the knowledge to answer that question. My colleague Devin Rose would be the one to do that. And so I will have to pass, but we can follow up with that later on.
And I'll, just because I know Rachel will be able to answer that, and I can just say that some of our science advisory committee members and have said very emphatically that they view the impact of the endoxylanase as actually enhancing the health impact. So you'll need, for a full answer, you'll need the scientists, but I can quote what they've said, which is, look, yeah, you're shifting the type of molecule, but in a way that also has a very positive benefit. We focus this presentation consciously on a business and science, because the people here are focused on business and science. But I also want to end with just the real reason to also look at this, that chronic disease is something that impacts vast portions of our population. In 3.5 years working on this, every single person that I've asked has had someone in their life that has been impacted by chronic disease. It brings us together. It's completely independent if someone is on one side or the other side politically, or if they're rich or if they're poor. And everyone in this room knows that every morning there are millions of children that wake up, and many of them say this beautiful prayer, give me this day my daily bread. And by making that bread just a little bit healthier, improving that quality of it, we're able to save millions of people from ever getting the chronic disease. And yes, that is really what's lying behind the billions of dollars of savings and the opportunities for revenues associated with it. So I'd like to transition now to more science. Emily Clarquist is here. And one of the key questions is, okay, so there's variety in our amount of arabinoxylan fiber in wheat. How much? Where is it? I'm very interested.